My name is Samuel Kyobe. I am a medical doctor, microbiologist, and lecturer in the Department of Medical Microbiology at Makerere University. I have a PhD in genetics and bioinformatics, and my PhD research centered on uncovering the host genetic factors influencing disease progression, particularly in pediatric HIV and TB. On the support project, I am a scientific coordinator postdoctoral fellow, and I am responsible for providing overall scientific coordination of the project to ensure successful execution of the proposed objectives. It should be noted that Sub-Saharan Africa bears a very disproportionate burden of infectious diseases such as malaria, HIV, AIDS, and TB, which probably accounts for about 90% of the global burden. And this poses very significant health challenges, including the socio-economic demands. But more importantly, accurate diagnosis of these diseases remains a very important factor, especially if we are going to have timely patient management, including the proper use of antibiotics. But there are various factors that hinder this, including the poor state of health facilities, which means inadequate laboratory resources, and therefore we cannot have proper diagnostic services. When you look at the structure of support and some of the things that support is proposing, this really exemplifies some of the efforts that can address these systematic challenges. For example, in support, we are going to evaluate several measures, including the performance of point-of-care tests, including the Stream 1, IP10, and also specifically one of the trainees or one of the fellows is developing AI tools to help classify and detect children with respiratory symptoms, to classify them, and this will really help in reducing the excess risk of readmission and high post-discharge mortality. Therefore, the success of these interventions under support has really a very high potential, especially to radically improve health outcomes among children with HIV. The ultimate benefit of the implementation of the results from support is probably towards a reduction in the misdiagnosis, allowing early and appropriate treatment for cases that are detected, and also mainly to reduce on the post-discharge mortality. So this research generally under support has a very huge impact on the global health, and it can contribute to reducing infant mortality and also contribute to the attainment of the SDGs. Thank you.